Hello everyone. Today we wanted to go over disc exercises. And so in the clinic, if we've diagnosed your condition as being a disc problem or the disc is involved, these are good exercises to do at home. At this point, your pain is decreasing, your mobility is increasing, and we want to improve your posture and your health going forward so you can help this process. The disc is like a jelly donut. It's between the bones. Here it's in orange on this illustration. And what we want to do for exercises for the disc is go to the opposite direction to the painful side. So if you're having pain going down your left leg on the left side of your back, we want to go the opposite direction to the right. We want to open up those discs. We want more room between the bones in these holes, the foramen for the nerve. And we want to stretch the tight muscles and ligaments that have been holding the bone out of place in a certain position. So, for example, for this lady, if she had pain on the right side of her back going down the right leg, we'd want to give her exercises to the left side, like she's doing here, to open up the space on the right-hand side. Okay. Here, I'm doing an exercise similar to her where tipping to the left-hand side, opening up the space between the bones, stretching those ligaments and muscles, allowing the nerve flow to get through. Another good exercise to do for disc is extension, and that's extending back at the waist, opening the discs up, giving more space for the nerves to come out between the bones, and stretching tight muscles and ligaments. One thing that I will mention is when you're tipping to the side, be careful you don't tip forward or backward. Sometimes I see patients tipping forward or backward as they go sideways. Just go in that lateral plane. Keep it very pure, the movement to the right or the left. Start with 15 repetitions first thing in the morning. So when you get up, just get limbered up, drink some water, and then do these exercises. Do 15 repetitions, holding for 1 second right at the end of the range. Then do 2 sets, 3 sets, and progressively go up as you're finding this easy. So keep going and work your way up to 15 sets of 15 repetitions, which is 225 repetitions total. Discontinue if sharp pain starts in that area or the symptoms worsen. Stretching, tightness, and a feeling of exercise is normal. So if you're feeling those feelings, those sensations, that's normal. Follow us on social media. We're at Dr. Cary Yurkiw on Instagram, Twitter, Facebook, and YouTube. Our podcast is called Super Healthy. It's on Apple and Android. If you have any questions, you can type them in the chat or in the comments. You can always direct message me or talk to me at the next appointment. If you know someone who needs help with their spine or their joints, then there's a link in the show notes. You can give them that link or share that with them. There's also a link in our bio on social media. You can click on that and then choose the option for a new initial appointment for a new patient. Usually we can see new patients within 48 hours. And we are open some weekends, Saturdays and Sundays. Approximately every second weekend we're open on Saturdays and Sundays. So that gives the patients a little bit more flexibility. Thank you for joining me today, and I look forward to seeing you in the clinic.